The word joint has a lot of definitions. As an adjective, it can mean something that is shared or undertaken by two. For example, someone might say they have a joint project with someone else, or they are participating in a joint effort with someone else. The word can also be a noun. In many places, it refers to a marijuana cigarette, for example. For this video, we're interested in another definition. A joint is also a place where two things are united together, either rigidly or in such a way to permit motion. This is Chapter 8 on joints in your anatomy and physiology class. The two things that are united either rigidly or in such a way as to permit motion are the bones. Let's get started. There's one simple objective for this video. It's to describe the different types of joints in terms of their structure and their functions. Joints are also called articulations. These are sites where two or more bones meet together. The function is to give the skeleton mobility and also to hold the skeleton together. We can classify our joints either according to their structure or function. Structurally, there are three types of joints based upon what materials bind them together and whether a cavity is present. The three structural classifications for joints are fibrous, cartilaginous, and synovial. Joints are classified functionally based upon how much movement they allow. There are three classifications based upon movement. First, you have the synarthroses. These are joints that are completely immovable. They may be slightly movable early in life, but as we age, they become completely immovable. Next, you have the amphiarthroses. These are joints that only allow small movements. The joints aren't completely immobile, but they do not allow the movement of the third group of joints, the diarthroses. Diarthroses are freely movable. If you think about the movement around your wrist or your shoulder, or the movement that happens when you bend your finger as an example, the joints that allow these movements are diarthroses. One of the easiest ways to actually study the joints in the human body is to study them by structure. So that's what we're going to do. We're going to start with your first group of joints, the fibrous joints. These joints are synarthroses, meaning that they are immovable joints. They may have some movement when we're young, but as we age, they become completely immobile. So the thing that classifies your fibrous joints is that the bones that make up the joint are joined by dense fibrous connective tissue. Most are immovable, but how immovable they are depends upon the length of the connective tissue fibers that cross the joint. There are three types of fibrous joints: the sutures, the syndesmoses, and the gomphoses. Sutures are a type of synarthrosis, that is, a joint that is completely immovable when we reach adulthood. The easiest place to observe sutures is in the skull. When we are infants, our skulls have two frontal bones, two temporal bones, two parietal bones, one sphenoid, one ethmoid, and one occipital bone. These bones are joined together by fibrous and elastic tissues, making flexible sutures like this one and this one. Some bones are joined by fontanelles, like this prominent one, called the anterior fontanelle. A fontanelle is a space between bones where sutures intersect. The brain is protected by a tough membrane called the dura mater that surrounds the brain. The fontanelles and slightly movable sutures allow the bones of the skull to move during birth, and later on allow the skull to expand as the brain grows. As we age, the sutures ossify and fuse, making the skull one unit that protects the brain. Some sutures of the skull, like the metopic one that joins the two frontal bones together, are very hard to see. They're almost imperceptible. These closed and movable sutures are called syntoses. Syntoses. Another example of a syntosis is the closed or fused epiphyseal plate of our long bones. A second type of fibrous joint that is also synarthrotic is called a syndesmosis. A syndesmosis. Here, bones are connected by ligaments, like this one and this one. The length of the collagen fibers in the ligament determines how much the bones will move. The longer the fibers, the greater the movement. For example, the interosseous ligament that joins the radius and the ulna holds the bones together when we have our palms facing forward or backwards. So you can see here that the bones are parallel when our palms are facing forward, but then when we turn our palms backwards, one bone, that's the radius, crosses the other, the ulna. The long collagen fibers of the interosseous ligament allow that to happen while holding the bones together in space. Short fibers, like you see here, offer little or no movement. For example, the inferior tibiofibular joint holds the fibula in position with respect to the tibia. The third type of synarthrosis is the gomphosis. The only example of this type of joint is between the jaws and the teeth. Because some of you watching may be wanting to go into dental hygiene, I'll take a few extra minutes here to describe gomphoses and teeth. First, teeth are not exactly bones, although they share some similar characteristics. Teeth are hard, calcified structures that are embedded in the mandible and maxillae. They contain a pulp, which you can see here in red, that consists of connective tissues, blood vessels, nervous tissue, and cells called odontoblasts. Odontoblasts build dentin. Dentin is a porous, hard, yellowish substance made of hydroxyapatite crystals, and it makes up the majority of our teeth, some 70% of it. In this drawing here, the dentin is this kind of strange greenish gray color, but you can see that it really makes up the majority of the tooth. In a tooth, dentin is covered by a white hard material called enamel on its superior portion. This is the part that we see above our gums. The gums are also called the gingiva, by the way, the gingiva. In the gingiva, so under the gum line, the dentin is covered by another material called cementum. And it's the cementum that's going to cover a tooth's root. Teeth are supported in a socket called the alveolus, located in the mandible and maxillae. And there's a ligament, which you can see here, called the periodontal ligament that connects the tooth to the socket. Cartilaginous joints are joints that unite bones via cartilage. For the most part, these joints have minimal mobility to no mobility. And there are two types of cartilaginous joints. The synchondroses, so here's that chondro term, remember that means cartilage, synchondroses and symphyses. Synchondroses are joints formed between two bones that are separated by a bit of hyaline cartilage. These are immovable joints in adults, and two examples are the epiphyseal plates and at the manubrium and sternum. In Chapter 6, we looked at how long bones get longer through interstitial growth. Hopefully you remember that when we are infants and children, there's a bit of hyaline cartilage that separates the diaphysis of a long bone from the epiphyses or the ends of that same bone. As the cartilage grows on the epiphyseal side, it ossifies on the diaphysis side. Then, as we enter puberty and young adulthood, under the influence of hormones, the cartilage growth is gradually outpaced by ossification, and in time, the cartilage ossifies, forming what we call the epiphyseal line. It is important to remember that once we reach adulthood, the joint is not supposed to move. The epiphyseal line, which would be approximately in this area, is what we would call a syntosis. A second example would be the hyaline cartilage that connects the first rib to the manubrium of the sternum. Again, this joint is immovable. Symphyses are fibrocartilage containing joints that are found between the vertebrae of the spine and between the os coxae of the pelvis. In both locations, the fibrocartilage acts as a shock absorber for the skeleton. Think about it. When you run or jump, spinal vertebrae would slam into each other if it wasn't for the intervertebral discs. These thick plates of cartilage that separate the vertebrae keep the bones from slamming into each other. The same is true for the pubic symphysis, located here, between the os coxae. It acts as a shock absorber for the pelvis when we run or when we're pregnant. Another thing to know about these joints is that they are amphiarthrotic, meaning they're only slightly movable, if at all. Now, I know what you're thinking. Look, Professor Foster, I can turn my torso almost 180 degrees. I can look behind me if I just move my shoulders like this. My spine moves a lot. And I would say that that's true. But if we look at the movement that's happening at each joint along the spine, there really isn't a lot of movement. But overall, it adds up to a lot of movement. Movement at the pubic symphysis is minimal, up to a 2 millimeter shift and only about 1 degree of rotation in most adults. During pregnancy, however, the activity of relaxin, a pregnancy hormone, causes structural changes in the symphysis that increases its width and mobility for this special time of life. Okay, let's take a few seconds to do a few review questions before starting the last type of joint. You know how we do this. I'll read the question. You push pause on your screen. When you think you have the right answer, press play again to see if you're right. Here's your first question. The site where two or more bones meet is called is it number 1, cartilage connection site, number 2, alignment site, number 3, auriculation site, or number 4, articulation site? Number 4, articulation site. Of course, remember joints are called articulations. Here's another one. Which of the following correctly lists the 3 structural types of joints? Is it number 1, bony, cartilaginous, immovable? Number 2, synarthrotic, diarthrotic, amphiarthrotic. Number 3, fibrous, cartilaginous, synovial. Or number 4, sutures, syndesmoses, gomphoses. Fibrous, cartilaginous, and synovial would be correct. Now, if you were getting ready to say number 2, synarthrotic, diarthrotic, amphiarthrotic, those would be the functional classifications of joints. This question is asking about the structural types. Here's another one. An amphiarthrotic joint exhibits which level of movement? Is it number 1, immovable, number 2, slightly movable, number 3, freely movable, or number 4, slightly immovable? I know this was kind of weirdly worded, but the answer I was looking for was slightly movable. The difference between number 2 and number 4 is the emphasis on movable versus immovable. Okay, just a few more. Of the following types of joints, which type occurs only in the skull? Is it number 1, suture, number 2, ball and socket, number 3, hinge, or number 4, symphysis? Of course you said suture. I would have been surprised if you got that one wrong. The ligament fibers of a syndesmosis, the degree of movement. Fill in the blanks. Is it the longer the ligament fibers of the syndesmosis, the greater the degree of movement? Or the longer the ligament fibers of a syndesmosis, the smaller the degree of movement? Or is it the shorter the ligaments of a syndesmosis, the greater the degree of movement? Or finally, is it the wider the ligament fibers of a syndesmosis, the smaller the degree of movement? What'd you think? I hope you said A, longer and greater is correct. Think about that interosseous ligament which allows the radius and the ulna to cross each other when we turn our palms from forwards from anterior to posterior. Which of the following joints is a site of long bone growth? Is that number 1, symphysis, number 2, ball and socket, number 3, gomphosis, or number 4, synchondrosis? What do you think? Right, a synchondrosis. Chondro means cartilage. And remember that epiphyseal plate that occurs between the diaphysis and the epiphyses, that's where that growth is going to happen, that band of hyaline cartilage. Last one, and it's a tough one. When someone has slipped a disc of the vertebral column, which type of joint have they disrupted? Would that be a synchondrosis, a suture, a symphysis, or the connections between the vertebrae that are not examples of joints? A symphysis. Absolutely correct. The most common type of joint in the human body is the synovial joint. These are the most mobile of all the joints. They are diarthrotic and provide most of the body movements that our bodies perform, especially in our limbs. There are a number of characteristics that are unique to these synovial joints. We will wrap up this video by talking about the 6 structural features of synovial joints. You'll want to pay attention to how these joints are stabilized. Your synovial joints have 6 structural features that you should be familiar with. The first is that the ends of the bones in these joints have a layer of articular cartilage in them. That's the blue layer that you see here. It consists of hyaline cartilage, and it prevents the bone ends from getting crushed during movement. The second structure that you should be familiar with is this, the synovial cavity. This is a small fluid-filled space that is unique to your synovial joints, and none of your other joints have it. Next, you have the articular capsule. That's this layer of membrane that you see here, the articular capsule. It's 2 layers thick. You have an external fibrous layer, which consists of dense irregular connective tissue, and then there's an inner synovial membrane. It's made up of loose connective tissue, and it makes synovial fluid that fills the joint cavity. Synovial fluid is viscous and it's slippery. It's a filtrate of your blood plasma and it contains hyaluronic acid. The main function of the synovial fluid is to lubricate and nourish the articular cartilage. It also contains phagocytic cells that help remove microorganisms that may wind up in your joints and debris. One of the other important features of your synovial joints is that they have reinforcing ligaments. There are three main ligaments that you should be familiar with. You have the capsular, which is just a thickened portion of the fibrous layer of that articular capsule that we were talking about. You have the extracapsular, so these are ligaments that are outside of the articular capsule. And then you have the intracapsular. They are deep to the capsule and they're covered by synovial membrane. The sixth structural feature that you should be familiar with is that your synovial joints have nerves and blood vessels associated with them. Nerves detect pain and they also monitor joint position in space. They also monitor stretch of your synovial joints. Capillary beds help supply the filtrate for synovial fluid. Some other features that you may see in some of your synovial joints include fatty pads. These help cushion the fibrous layer of the capsule and the synovial membrane or a bone. You also sometimes find articular discs. These are called menisci, and you'll find them especially in your joints. The articular discs are little plates of fibrocartilage that separate the articular surface and improve the fit of the bones. This helps to stabilize the joint and reduce wear and tear on them. So for example, a lot of people familiar with sports know that there is a meniscus in the knee, and occasionally athletes will get a knee injury and they'll break off a little piece of that meniscus. It's called a mouse, and a surgeon has to go in with an arthroscope to basically cut that out of the joint so that it works the way it's supposed to. In addition to those 6 structures of your typical synovial joint, some joints will also have bursae and tendon sheaths. These are bags of synovial fluid that act as lubricating ball bearings. They're not part of the synovial joint, but they're closely associated with it. Bursae are kind of like this. They reduce friction where ligaments, muscles, skin, tendon, or bones would rub together around a joint. That rubbing could cause inflammation as well as damage to the joint. Here's another example of a bursa. Tendon sheaths are structures like this one. These are elongated bursae, and they wrap completely around tendons that are subjected to friction as our muscles contract, okay, and the tendon may rub up against a bone, kind of like you see in this example right here. So it decreases friction. Joint stability happens due to 3 main contributors. The first contributor is ligaments. Ligaments, remember, are these bands of fibrous connective tissue. And what they do at a joint is they help hold the bones together and prevent excessive movement at the joint. The more ligaments that a joint has, or the shorter the collagen fibers in that ligament, the more stable the joint will be and the less movement there will be. One thing you should keep in mind when you think about stability of joints is less movement means more stability. A second feature or contributor to the stability of a joint is the arrangement and the size of the articular surface, that joint surface. The more joint surface that's in contact between the bones, the more stable the joint. Just as an example, your shoulder is less stable than your hip. The reason for that is this. This is the glenoid cavity from a scapula. Okay? This is the head of the humerus. So you can see that the head of the humerus is much larger than the glenoid cavity. This means that there's not very much articular surface in contact between the two. This means that the shoulder is going to be less stable and more prone to dislocation. Compare that to this. This is the head of the humerus, and this is the acetabulum. Remember, that's that socket that's in the hip, in the os coxa. The acetabulum almost completely encloses the head of the humerus, of the femur. So this is going to provide more stability because there's more contact between the articular surfaces. I wanted to show you this picture. It's another drawing of the hip joint. So you can see there's also, in addition to the increase in the articular surfaces, you have a ligament called the ligamentum teres that helps hold the head of the femur into the acetabulum, and then you have these external ligaments also that help hold the bone in place. So this means that the hip joint is going to be much more stable than your shoulder. Third thing that helps to stabilize your synovial joints is muscle tone. Muscles help to minimize excessive movement and hold bones in place at a particular joint. For your shoulder, you have rotator cuff muscles that help keep the humerus in the head of the glenoid cavity. When you have loss of muscle tone due to age or immobilization, or maybe there's an injury in which the rotator cuff muscles have been torn and are thus weaker, the shoulder becomes much more prone to dislocation as a result. So here's a few questions just to make sure that you're still with me, and then we're going to wrap this video up. So all synovial joints is the answer diarthrotic, amphiarthrotic, synarthrotic, or none of the above? Diarthrotic is correct. These are the freely movable joints. They are the most mobile joints of all the joints in the body. Which of the following synovial joint components is responsible for secreting synovial fluid? Is that the articular cartilage, the synovial cavity, the articular capsule, or the synovial membrane? I knew you'd get this one right. The synovial membrane. Synovial membrane secretes synovial fluid into the synovial cavity. It is all connected by that term synovial. What is the name for the flattened sac that reduces friction between adjacent structures during joint activity? Is that a tendon sheath, meniscus or menisci, bursae, or is it synovial membranes? Bursae, that's right. Bursitis, by the way, is a condition in which the bursa around a joint becomes inflamed, either due to infection or overuse. This can reduce the mobility of a joint and cause lots of pain in the people who experience it. All right, so in this video, I described the different types of joints in terms of their structure and function. Remember, structurally, you had the fibrous joints, the cartilaginous joints, and do you remember what the third one was? The synovial joints. We also described joints in terms of their functions. So we talked about the synarthroses, the amphiarthroses, and the diarthroses. In the last part of the video, I spent quite a bit of time talking about the structures of a synovial joint and how those joints are stabilized. On an exam or a quiz, you should expect that the synovial joints especially, structures as well as stabilizing factors would be on that assessment. So that's it for this video. In my next video, I'll talk about movements that occur at your synovial joints. I look forward to seeing you there.